Hey, it's Virginia, and in this video, we are going to go through a document and I'm going to share some feedback on how to improve the medical writing in this document. So let me just share my window with the document that was submitted by someone from the Medical Writing for Beginners and Beyond group on LinkedIn. I'll leave the link down below if you want to join. So this document says Hyperemesis Gravidarum, which is a type of vomiting that occurs during pregnancy. And I would say the first thing I would change about this article is the title. So I'm not actually sure if I was a person who didn't know anything about this topic, what this article would be about, because this is a very difficult phrase to actually type into Google or even to search. So I would say maybe the title could be improved to pregnancy, nausea, and that already makes it just a little bit clearer and easier to understand for the person who's going to be reading it. Then I would change this to the title or the H1. So I'm going to stick with H1 for now. So now, if I open up the document headlines or headings, then they are going to be in the correct order. So I'm just going to minimize that for now. So the opening sentence is, pregnancy is often painted as a glowing journey full of cravings, cute belly kicks, and soft smiles. But for some women, it begins with a storm. So I would say that this very first sentence is a little bit mixed. So it says glowing journey, and then it says full of cravings, and then it says cute belly kicks and soft smiles. So there are three positive things, and then one, which is the full of cravings, that could be a little bit questionable. So I would probably remove that completely. And then you've got more contrast between the first and the second sentence. So you've got the positive aspects, so the glowing journey, cute belly kicks, and soft smiles. And then the negative aspect. So the contrast is what makes me want to continue reading if I was the reader. Then the next part is very visual, which I like. So it says, imagine waking up every day for weeks, not to morning joy, but to violent vomiting, endless nausea, and a body that feels like it's shutting down. You're told it's normal, that it's just morning sickness, but deep down, you know this isn't normal. You're not being dramatic. You're sick, really sick. Okay, so this is, like I said, quite visual, and it's trying to connect with the reader and maybe the emotional kind of feelings that they're going through. I'd say this is probably, missing a comma. So I'm just going to add that in there. And then here it says what you're experiencing could be Hyperemesis Gravidarum, HG, in brackets, which I like. So I like that if you're going to start abbreviating something or using an acronym, then you should definitely have that in brackets at the first time you mention it. So I also like that it says could be. So it's not for definite because we don't know. We're not diagnosing here. We're giving someone information. And so this is maybe a possible path that they could go down and then hopefully seek treatment for. And then it says a condition far more serious than the typical queasiness many expect in early pregnancy. So I would say to kind of strengthen this sentence, I would include some kind of statistic or evidence-based fact from some kind of research. It says how many people experience nausea when they're pregnant and in what time period. So is it mostly the first trimester? And then how common is HG? So the next section goes on to introduce what HG is. And I would say, again, you should try and format your headings. So this just says introduction. So I'm going to make it a H2. And I would change this as well to something else. So what is Hyperemesis Gravidarum? And this is something that someone might actually type into a search bar. So we're SEO optimizing here. So search engine optimization. You're trying to think of what people will type in, and then you actually answer those questions. So it goes on to say, HG is a severe and persistent form of nausea and vomiting during pregnancy. Okay. Unlike regular morning sickness where women vomit 1 to 3 times a day, women with HG vomit 5 to 10 times or more per day. And this excess nausea and vomiting results in weight loss and dehydration as women are unable to keep any food or water down. Then it says this condition could lead to complications during pregnancy and require hospitalization or frequent hospital visits. So I'd probably switch those two around because hospitalization would probably be the most severe outcome. So I would change it from frequent hospital visits or require hospitalization. Just remove that one. And then it says progression here. So again, I feel like this heading could be improved. So I'm going to change that to H2. And I'm going to say, how does HG progress? I would definitely type out the whole thing. And then it says, in the first few weeks of pregnancy, the hormone estrogen and HCG, human chorionic gonadotropin hormone. So I would actually put HCG in brackets here rather than what it actually is. Oops. Put that in brackets. Are produced to support fetal development until the placenta is properly formed. So depending on the audience for this article, I would recommend maybe making it a bit easier to read, to say support development of the growing baby rather than fetal development. That might be a bit more accessible or easier for people to read. And then it says, in some women, their body overreacts to the sudden increase in these hormones and sends signals that affect the vomiting center in the brain. So something sends signals, but there's a little bit of a gap here. So what's actually sending signals? Is it nerves? And where are those nerves placed? So we need a little bit of a clearer picture of the cause. This is the body's way of providing a defense mechanism. Okay. Most times the nausea and vomiting from HG resolve after the first trimester of the pregnancy, while in some women it persists until after pregnancy. I think there's a full stop missing here. And then also, again, I would recommend putting some kind of statistic or some kind of fact or data to support this statement. So it says most times, but it doesn't tell me out of a sample size of women or how recent there was a study. So we want to try and make this more evidence-based. So common risk factors, again, I would make that a heading. So what increases your chances of HG rather than risk factors? Because I think risk factors is a very kind of technical term and a lot of people don't understand what a risk factor is. So there is an increased risk of developing HG in the following situations. As easy to change that to chance. Increased chance of developing HG in the following situations: first-time pregnancy, twins or multiple pregnancies, triplets or quadruplets. I'll remove the full stop from inside that bracket. Family history of HG, especially if the woman's mother or sisters experienced it. Okay. Molar pregnancy, an abnormal pregnancy where a mass grows instead of a healthy embryo, and abnormal hormone levels. So in brackets here, I would probably add what those hormones are, because it's not all hormones. It'll be specific hormones. I really like that these are bullet points, by the way. It makes it really nice and easy to read. Signs and symptoms of HG, and I'll make that S smaller. So is this meant to be a new heading? I'm not sure, but I feel like it is, because we've switched to a new topic, because the signs and symptoms wouldn't really fit underneath what increases your chances. So we've moved from risk factors to signs and symptoms. I might actually rearrange this. So signs and symptoms might be up here because we've defined it. So what is it? And I'd probably put signs and symptoms in this space here. So if I just move that around, then it probably makes more sense underneath the what it is. So definition, and then signs and symptoms. Then you've got how does it progress, and then what increases your chances, and then you've got management and treatment. And I think that's another heading, of HG. Then we've got anti-nausea medication. So that doesn't need a capital letter because it's a medicine name. So ondansetron, promethazine, oral rehydration salts, electrolyte-rich fluids, coconut water. So we need to decide if we're going to have capital letters at the beginning of bullet points or not. But it looks like most of them are capital letters, and IV is definitely both capital letters, I and V. Then you've got electrolyte-rich fluids, coconut water, small frequent meals, bland food, food containing less spice or fat, e.g. white rice, plain noodles, oats, etc. So I think that etc. is just with the period point in the wrong place. And then we don't need a full stop on the last bullet point. Then you've got ORS preparation down here, which seems a little bit out of place. So I would probably move that up here. So you're giving a recipe over here, which says ORS preparation, 6 teaspoons of sugar plus half teaspoon of salt plus 1 liter of clean water. So I would probably change this to 6 teaspoons of sugar plus half a teaspoon of salt mixed in 1 liter of water, of clean water. So that just makes it a little bit more accessible. Or you could even change this to you can prepare ORS at home by mixing 6 teaspoons of sugar, half spoon in 1 liter of water. And that just makes it a bit more readable and also a bit more relevant and in the right place on that bullet point. So instead of drugs, I would say medicines, just because that sounds a little less scary. I think when people think of drug, they think of something you shouldn't be taking. And then here we've got an AI generated image, I think, because that belly button looks a bit weird to me. And I think there's some kind of logo here in the corner as well. And then also this man seems to be missing his thumb on the other side of the cup. So I would definitely say if you're going to use AI images to declare that they are AI images. I'm not sure if the first image was AI, but that looks like a photograph. But I could be wrong. So who knows what's real? So then we've got a little bit of a conclusion down here. So we're no longer under the management and treatment of HG. So let's just put final thoughts, maybe. And then make that heading. So now we know we're at the end. So HG is not just a tough pregnancy, it's a test of strength, endurance, and hope. I think that might be a little bit interesting to say from a healthcare perspective, because I would probably choose reassurance and empathy over here. So, and you can get help for it. So you can have a healthy pregnancy, might be a little bit more reassuring. Then it says, behind every hospitalized mother is someone fighting to stay nourished, stay strong, and stay connected to the life growing inside her. As caregivers and companions, may we meet that strength with deep empathy, time, and care. I would probably cut this whole thing because that sounds a bit scary. And then it says, no woman should have to suffer in silence through pregnancy. Hyperemesis is real, exhausting, and it deserves care. So I'm not sure who said this or where this quote is from, but we would want to credit this person. And then I would recommend some kind of call to action. So if you feel unwell, please see a doctor or your midwife for advice. And if you want to, you could also say, read this article next on some kind of related topic. So maybe if you know that they're pregnant and they're not feeling well, you might want to suggest recipes for foods which are easier to digest or less likely to upset your stomach, anything that's kind of related. So now if we have a look at all of the headings, it's much easier to see the sections of the article. And yeah, I think overall it was pretty good. I didn't change too much. And I really like the bullet points here. I think probably one last thing I would add is, here are a few suggested ways to manage and treat HG, just so that people know what the bullet points are about, because it's quite tempting to just have a heading and then just put bullet points straight away, but you want to try and have some kind of introductory sentence. So similarly under this one, here are some signs and symptoms of HG. And so that kind of confirms that what's underneath the heading is actually what you're looking at. There was one thing here as well, DKA. I'm not sure what this is. So this needs to be defined, and then DKA needs to be in brackets. The body breaks down fat to produce energy when we fast or starve. The breakdown of fat causes increased ketones. And then I'm not actually sure what the point is here. So are you trying to say that if your body's gone into starvation mode, you're starting to produce ketones and that can make you feel ill? So you've kind of got that point here in the bullet point, but you've kind of disconnected it down here. So again, I would probably put that under that bullet point or separate out this bullet point so that it's its own section. May also be a sign of HG. If you recall from, then just to kind of complete that sentence. So another thing I would add is that at the end, I have no references. So I don't know where any of this information came from or how to validate it. So what were the sources of information? Good sources of information are things that come from places of authority. So for example, in the UK, we have the NHS website, or maybe we have NICE guidelines, or maybe in the US, you have the CDC. And then another thing that needs to be included is who wrote it. So it would be written by whoever, and then who reviewed it. So reviewed by someone else. And then also the date of publication. So this will be when you actually have it live and people can read it on the website or wherever this is going to go, if it's a leaflet or something else. And then the review date as well. So then people know when it came out and also how up to date it is. So you could say our articles are reviewed a minimum of every 3 years or something like that. And so that really adds credibility to the article because you know that someone has looked at it and they have the intention to review it just in case. And then you might find a different article somewhere else which may have been published after this one, and that one might be more up to date because sometimes medical guidelines and research and things like that, there's always new information coming out. All of that stuff gets updated. So I hope you enjoyed this video and you found it useful and you learned something about medical writing. And if you want me to look at your medical writing, then you can email me at hello@virginiachachati.com. And if you want to take a course on learning medical copywriting to write things like the blog that I just reviewed, then there is a medical copywriting for beginners course where you have to write a blog. You also have to write social media posts, and I review all of those and I give you feedback as well. So then you can improve your skills. So you can check out those links in the description box below. If you're thinking about joining a medical writing community where you learn from more things like this, then you can join the International Medical Writers Association, which is a private community on LinkedIn. I hope to see you there, and I'll leave the link to that in the description box below as well. Thank you so much for watching, and I will see you in the next video. Bye.